everybody, it's Jenny from MedEd again, your CNA instructor. So the next procedure I'd like to go over with you is assisting to move the resident to the head of the bed. So when you're looking through your procedure, it's going to tell you how to do it if you're by yourself and how you do it if you have two caregivers. Today, I'm just going to focus on how you would do it if you were by yourself. So the first thing we're going to do is do our initial steps. I'm going to ask my nurse about my resident's needs, abilities, and limitations. I'm going to knock on the door, request permission to enter before I go in. I'm going to call them by the name they prefer, identify myself by name and title, and explain what I'm going to do. I'm going to find and gather my supplies, and for this procedure, I am the supplies. H, close the curtain, drapes, and doors, keeping the resident's body covered. I'm going to wash my hands. I'm going to wear gloves as indicated by standard precautions, which means body fluid. And I'm going to use good body mechanics. So to assist a resident to move to the head of the bed, first, put the bed flat or in supine. Next, to protect the resident, put the pillow up against the headboard. Maybe you're a little stronger than you think, or maybe the resident's a little stronger than you think. Underneath the sheets, you're going to go under both shoulder blades and under both thighs. Now again, this is a mannequin, so when you have a real person, just have them bend their knees so they can push with their feet to go up to the head of the bed. So ask them to bend their knees, go under the shoulder blades and thighs. Bend your knees, keep your back straight. And we always move on the count of 3. So on the count of 3, we're going to go up to the head of the bed. 1, 2, 3. Put the pillow back underneath their head for comfort. Position them for comfort. And do your final steps. A, we're going to check alignment, make sure they're comfortable. B, make sure the bed is in the lowest position. C, make sure they have their call light and water. D, ask them if they need anything before you go. And E, everybody deserves a thank you, so thank the resident. F and G, find and gather your supplies, clean them to company or facility policy. H, ask them how they want those hanging curtains, open or closed. And then I'm going to eye my way out the door. I'm going to wash my hands. I'm going to do a visual safety check, report unusual findings to my nurse, and document. Thanks for watching. Hi everybody, it's Jenny, the CNA instructor from MedEd again. So the next position I would like to go over with you is supine position. Now this isn't a difficult skill, but there's little things that you kind of have to focus on so you pass it and you keep your residents' comfort in mind. So before any procedure, do your initial steps. Ask your nurse about your resident's needs, abilities, and limitations. Knock on the door, request permission before entering. Call them by the name they prefer, identify yourself by name and title, explain what you're going to do. Find and gather your supplies, find and gather your supplies. Close the curtain, drapes, and doors. Wash your hands, wear gloves as indicated by standard precautions, and use good body mechanics. So supine position just means flat in bed. You want to make sure your resident is moved to the head of the bed so their feet don't touch the footboard, and it keeps the trunk in good position. My resident's lying flat on their back with their legs slightly apart. Legs slightly apart, the thighs are a friction area and can cause skin breakdown. We can put supportive padding as necessary. So if they would like pillows or padding, we can put it underneath their head, underneath their arms, underneath their legs. We can float their heels. But very important, you never put anything underneath the knees unless you are instructed to do so by the nurse. Check the resident's alignment, make sure they're comfortable, and then do your final steps. A, check alignment and comfort. B, make sure the bed's in the lowest position. C, make sure they have their call light and water. D, ask them if they need anything. And E, thank them. F and G, find to gather your supplies, clean them to company or facility policy. H, ask them how they want those hanging curtains, open or closed. And then eye your way out the door. I'm gonna wash my hands, I'm gonna do a visual safety check, I'm gonna report unusual findings to my nurse, and then I'm gonna document.